My name is Hinde. I am a speech language pathologist and an oral myofunctional therapist in Richmond, Virginia. I am the founder and the owner of the Center for Speech and Swallowing, and I took Walt Fritz's class in 2022 with another SLP who works here and a graduate clinician who was here at the time. Our primary population at the Center for Speech and Swallowing ranges from infants through adulthood. We see feeding, speech, oral myofunctional issues, and we specialize in oral ties. The reason the touch-based work is so important for oral ties is that when we are able to address the tissues that are affected by the ties, we can get a greater amount of function without necessarily having to go and send people for surgery. So what we find is that when we work inside the mouth, when we work around the platysma, even the diaphragm releases, pretty much everything that we learned at the course has been instrumental in helping people to get more function without having to actually go and have a surgery. Now, in the cases where they do go for surgery, the release providers have given us feedback that when the patient has had several sessions of touch-based work, the providers themselves are finding that the surgery goes better. They get a more complete release. The healing goes better. So that is huge. It's really, really important. Anybody who is working with oral myofunctional issues or oral ties and not incorporating some sort of touch-based work is really not doing the greatest service for their patients. Now, in terms of getting comfortable with doing the work, it is true that as speech pathologists, we're not encouraged to provide manual therapy historically. And that doesn't make any sense at all because we're working with muscles. So I've had a lot of other speech pathologists ask me, gosh, how do you justify doing this? Well, why shouldn't we be doing this? We are the experts on the mouth, the oral mechanism, the swallowing mechanism. So we had the luxury of having each other since 3 of us went at the same time, and we practiced on each other. We got comfortable, and it didn't take too long before we were incorporating it with our patients. It's very easy to incorporate it with the adult patients because you just explain to them what you're going to do, why you're going to do it. You give them that ownership of giving you feedback. Is this useful to you? Would it be better if there were more pressure? Would it be better if there were less pressure? Is this okay? Tell me, let's have a dialogue. And people really respond to that. People are not used to their medical providers saying, hey, I'm really interested in your take on this. And people respond extremely well to that. We have people who come in and they ask for the same treatment that you did the last week when they were here. Oh, can you do that one where you put your hand on my chest? That just felt so good and my neck really relaxed and I've never had anything feel that good. And then we have other people who stand up and they say, wow, I feel like my head is not even attached to my body. And they mean that in a good way because these are people who have been suffering from pain in their jaw, pain in their neck. Sometimes it is a matter of tension when they swallow, people who are having difficulty swallowing pills. And we've never had anyone complain about it. We've never had anyone say, no, thank you, I don't want that manual therapy today. On the contrary, people tend to be more willing to be the recipient of touch-based work rather than doing the actual exercises and therapeutic activities that we have for them to do as well. So sometimes we actually have to strike a balance where we say, okay, we've been doing a lot of that manual therapy and it's really good for you and we're going to continue, but we also need to do these other modalities. So the feedback's been great. It feels like we're really giving the patients everything they need, not just part of what they need. If you haven't taken the course, I strongly recommend it. See if you can take a colleague. It's just the best thing, in my opinion, that's ever happened to speech pathology.